Hello, everyone, and welcome. My name is Teresa Baker, and I'm one of the physical therapists at Boston University Center for Neurorehabilitation, which also houses the APDA National Rehab and Resource Center. We are so pleased to have everyone here today. This is the second in a three-part series presenting on all aspects of balance. The last time we met, Tim gave such a wonderful overview with his presentation, Balance 101, which to note is archived in the APDA YouTube channel. So for any of these past presentations that you haven't seen, you can go ahead and check them out on the YouTube channel. But today, we are so pleased to have Sara Zoeller continuing this series with a presentation called Staying on Your Feet, Pushing the Boundaries of Balance. So we are so pleased to welcome and bring on Sara.
Hi, Teresa. Thank you for the introduction. And hi, everyone. My name's Sara Zoeller. I'm a physical therapist working with Teresa here at Boston University. Just want to say it was nice to see some of you last week at the World Parkinson Congress, if you were there. And we're happy that you're joining us here today. So to give a little background on balance exercise, there is significant evidence in the field of exercise training related to balance in Parkinson's disease. A lot of the evidence has been studied in people with mild to moderate Parkinson's disease, but here are three examples of some larger studies that sort of collated articles from different groups. And so the first one is a Cochrane review, which is one of the highest levels of evidence. And that looked at studies for intervention for reducing fall rates in people with Parkinson's disease. And they did find an improvement with exercise, including balance training. The middle one is a 2026, a very recent article that looks at about 30 different studies. And that contributed to our understanding that balance exercise, and specifically balance exercise compared with other types of exercise, can improve people's with Parkinson's balance ability. And the final one I'll just point out here is one that's in the physical therapy literature that also looked at a variety of different studies and suggested that physical therapists should be recommending balance training for their clients with Parkinson's. So we know that balance exercise can be effective in improving balance and should be a good part of an exercise program. I do want to, before I continue on, just give this disclaimer today that we're going to give some examples of different exercises and balance training and share some general recommendations, but really importantly, it should be individualized. So we'd like you to work with a physical therapist or a healthcare provider to design a program that's unique to you. And then depending on your ability and your competence, you may also benefit from someone to supervise the exercise, at least to begin. So these are just some examples. We're not recommending any specific exercise over another. And we really do believe that exercise should be individualized. And I think one of the fun things about balance training is that we've seen studies in all sort of different types of training, whether it's exergaming or home exercises or some community programs. And across different types of balance exercise, you see improvements. So you can make it unique to yourself and your interests. So we know it's good, but how to get started? So we recommend starting early after diagnosis to make sure that balance is a part of a comprehensive exercise program. It's never too early to start. And even for older adults, balance exercise is recommended in the general population. So even more important in Parkinson's, where we know that balance can be a problem. If you're someone who experiences medication fluctuations in terms of the when to do the exercise, we typically recommend doing it when you feel like the medication is kicked in. During that on time, you'll have a little bit better performance and be able to do the exercises to get the most out of them. In terms of dosing, it's a little less clear and balanced compared to things like aerobic training or strengthening, but the evidence comes down to about 2 to 3 days a week. And usually we also can kind of think of it in terms of maybe around an hour a week. If you break it down into 2 or 3 days, that's like 20 or 30 minutes. It doesn't necessarily mean you can't do shorter bits like 10 minutes 5 or 6 days a week, you can still get some benefit out of that. And if you're starting, it's okay to work up to that. You don't have to start with that full 2 or 3 days or an hour a week. We again recommend individualizing this training by seeing a physical therapist to assess your balance. They can help you decide what needs the most work and where you might be able to challenge yourself. You can also consider a class, especially if you are feeling pretty good and not noticing a lot of balance deficits, and you want to just get something into your routine. There's lots of community programming that can work on your balance. In terms of where to go, where to do this, it really depends on your preference. Again, there's lots of options for balance training. So you could set up in your home, you could do it by yourself at a gym, you could consider a class. Depends what you're interested in terms of that social component and that supervision, as well as making sure that you have a safe setup. So some options that we sometimes recommend in the clinic to make sure balance training is safe are to have support nearby, usually a counter, a support surface, sometimes something like a wall or a corner. Sometimes people benefit from having a chair behind them so they can sit quickly, or if they lose their balance backwards, they have a place to sit, or even exercising with a buddy to sort of supervise. But that really depends on your level. And one thing I'm wondering if we could sort of engage a little bit is if you have any tips from your own experience of things that have worked for you for safe setup for balance training. If you want to go ahead and put them in the chat, I think we learn a lot from people's individual experiences and what they've found successful in the past. So if you have something you'd like to share in terms of making your balance exercise safe and accessible, go ahead and throw it in the chat. So also in getting started, we want to think about how hard is the balance training. So when we think about aerobic training, intensity means breathing heavier, having a harder time talking, heart rate goes up, we sweat. Balance training is a little bit trickier to define intensity, but when we think about it as physical therapists, we think about it as you're working at least a little bit to maintain your balance. So you're having to put some effort in. You're feeling that sort of wobbly. This is something I often find myself saying in clinic, wobbly but safe. So it doesn't want to feel like you're afraid of the training or you're about to fall. You always want to feel like you're in a safe environment, but when you're training your balance, you have to test your balance a little. So there should be some wobble, an occasional step, things like that. It should feel challenging. And this scale here, this 1 to 5, is just one example of a scale that can help you for yourself gauge. You definitely shouldn't be at level 1, right? And we probably shouldn't be at level 5 most of the time. But somewhere in that middle ground is a good place to be. And that can mean working up to it. So if you're new to balance training, you might start with something that's around a 2. Start with something that feels a little easier and work your way into harder exercises as you get more confident. Even within a session, sometimes I'll recommend people start with a slightly easier exercise. So start with something maybe where their feet are apart and then transition to moving the feet closer together, or start with a particular movement and then add a multitask to make it a little harder to maybe bump up from that 2 to a 3. So it doesn't have to be perfect, but this is to say you'll get the most out of your balance training when you're really challenging your balance and feeling a little bit of that wobble. So this is a little bit of a review from Tim's presentation, but this is to show just one way to sort of define different areas of balance. So if we look at this, we'll then go into some examples for different exercises that could address these types of balance. The first one is steady state. So that's your balance standing in place, controlling how you're standing in one position. And so examples of that might be standing on even an uneven surface or doing some things with eyes closed to sort of test that self-body awareness. Anticipatory balance is when you're planning to and initiating any sort of movement. So controlling that active movement that you're intending to do. That includes what we call as physical therapist dynamic balance, which has to do with balance during walking or changing directions. So classic examples of this are standing up from a chair or doing something like walking and turning, even walking over uneven surfaces. And so I think, not to generalize, but a lot of our balance training kind of can fall into this category. Finally, we have a reactive component to balance, and that can be either a step or what we call a sway. So you start to lose your balance and you kind of correct it and bring yourself back to the middle. And that can be in response to either what we call an internal perturbation. You lose your balance doing something, and all of a sudden you have to correct, or an external perturbation, which would be something like you got bumped into, or you're on a moving surface and it stops quickly and you have to adjust. So there's multiple ways to sort of train that reactive component, and anything that is requiring that sort of necessary step or lean and react can go into that category. So we will cover different exercises just as examples that fall into these categories. But before we do that, I'm going to just cover one of our sort of philosophies behind balance training, which covers across the different types of balance exercises, which is to make it what we call functional. So to tie it back into something you're doing or you want to do better, something that you maybe need to do, or something that's fun to do. So you get a twofer here where you're training the activity itself and you're working on your balance. So here are some examples of that. One is getting up from the ground. So practicing getting up from the ground, which is a helpful skill, but also can be a balance challenge. Additionally, getting up from a chair. Sometimes we joke the physical therapist's favorite exercise because it's so functional. You get some strengthening and you get some balance out of it. And then the third example here, this picture is sort of to give an example. Say this person wants to go hiking. They're going to have to step over sticks and rocks and puddles. So they're going to work on taking these sort of high, big steps, but with the goal of going hiking. So other examples I can think of are if you're maybe someone who likes to ride your bike outdoors, maybe you do something for balance training where you're turning your head to work on that scanning with your balance. If you're someone who has kids in your life or grandkids, maybe you're working on some agility patterns that are like hopscotch or kicking a soccer ball back and forth. So, those pickleball players out there, ever growing numbers, you're doing some quick side steps to try to work on your pickleball game. So you want your balance to sort of help you in your daily life, not just by improving it, but also by training these activities. So then going back to those three categories, the first one we talked about was that steady state. Can you control your balance in one place? And so single leg is an example of this, trying to balance on one leg. You can also see sort of holding a lunge position. I know someone in the questions ahead of time asked, how do I train when one side is more effective than the other? This is sometimes a way where you can kind of bias one side, or you can adjust. You can do single leg balance on your stronger leg with the other leg lifted all the way up. And maybe if it's harder on the more affected leg, you can do just a light toe touch or something to sort of help out, but still be challenging yourself and getting that wobble on the leg that's more affected. And then here you also see the one in the middle where someone's training maybe on foam or maybe with eyes closed to sort of vary the input that they're getting. When we talk about those anticipatory balance, so a planned movement, here's one example that's walking around cones in a figure 8 pattern. And so this is also looking at training something we know can be challenging for people with Parkinson's, those turns, and getting some balance along the way. So working on turning and turning in both directions. This is an example of a task that has a little bit of an agility component. So to explain the task here, he's taking 2 steps forward, and then what's shown is taking 1 step back, bouncing the ball, and then moving forward again. So there's a cognitive, a thinking, and a sequencing component here to work on. And there's also change in direction. And then we can add in things like faster footwork. This is one that brings up a good topic, which is combining your balance and strength training. So the sit to stand, and you can see here we added a band for a little resistance to challenge the hip muscles a little bit more. So sometimes all it takes is a little tweak in some of your strengthening exercises to get the balance layered in as well. You can see she's also at the end going up onto her toes for a little extra challenge. So it's thinking about, are there things even maybe you're already doing if you do regular strength training that a little change in foot position or a little add-on to the end might give it a balance component as well. And then here's one more example of an anticipatory training exercise. And this is sometimes called a box step, but he's stepping into the four corners of the box in a sequence. And so this gets at that moving in different directions. It also could be something where if you were training with someone, they could ask you to change directions. You could add a multitask. Multitasking is one thing we know is challenging in Parkinson's and can be beneficial to add into balance training when it feels like it's safe and that kind of right level of challenge. So this is sort of a versatile exercise that can help you move in different directions and can be made a little bit easier or a little bit harder. So finally moving into reactive training, it's a little harder to show in a way, but I'll show a few where that have those kind of internal perturbations where someone's doing something, they're losing their balance a little bit and then having to step. So this is an example of a wall push-up. The person pushes up against the wall and then comes back far enough. They push far back enough that then they have to take a step at the end to catch the balance. And then here are two examples. One is trying to, walk really high, stand on one foot, but you can see he's leaning over, having that kind of compensatory sway, having to sway and maybe step at the end or maybe not. And the other person here is stepping over hurdles and has to take that crossover step for an extra reaction when she loses her balance. So you may have noticed in these pictures, for the most part, that there is someone with the person. A lot of times reactive balance training can be most helpful when there's someone nearby for a little extra safety. There is also in physical therapy, sometimes we will do more external perturbation training, and that would be a physical therapist either doing something where you lean, let go, and have to take a step, or even giving little nudges as you're doing a task that's already challenging. There are also some clinics that have equipment that will help do that, a treadmill or a platform. So there are ways to do that sort of external perturbation training or external reactive balance training, but that's not so much something that you'd be doing either sort of on your own or at a gym or something like that. So finally, just to kind of start to bring things together, I did mention group exercise at the beginning because it can be a very effective way to get some balance training. So some benefits of group exercise is you get a variety of movements. The movements might change from week to week or day to day. I think it's fun. I think it can be really fun. You can also have sort of that skilled component of learning something like dance or martial arts. There's a social component, which should not be underestimated by any means. And then there's someone there usually who's giving some reminders, some cues, some suggestions, someone you can bounce ideas off of. So there's a lot of benefits to group exercise. Some of the potential downsides, but I think easily worked around, are that it's less individualized and might bias towards one of these types of exercise more than the other. But I think you can work around that for the most part by either yourself trying to modify a little bit or working with your instructor to make things easier or harder to meet that right level of challenge for you. And also to kind of supplement with your own exercises at home, maybe in the areas that your group isn't addressing so much. So if you're doing something like yoga, where you do a lot of posture standing in one place, maybe the training you do at home on your off days from yoga has to do more with those multi-directional movements. So here's an example of some common group exercises and sort of where we think they might fall into these different types of exercise. It really does depend on the group and on the person as well. So it was hard to decide for some of these where to put the check boxes. I think dance is a great example where if you're doing a partnered dance, which can still be very beneficial, but you might not be getting as much reactive stepping because you're, holding on and having that more support and more guidance. But if you're doing a line dance and you're changing directions and someone's in front of you bumping into you, there might be a lot of reactive balance training lined up for that. So it really depends on sort of your body and your class itself where these fall. But this is just to give an example and to show that, some types of exercise we know kind of fall more or less into some of these categories. All right, this is just to wrap up a little before Q&A, which I'm really excited about. Before Q&A, I will also say, if you want to go back to that chat, I gave some examples, but we'd love to hear from you. Like if you have a favorite type of balance exercise, something you feel like works for you, something you like to do, go ahead and put it in the chat. We'd love to hear from you what you feel like is effective and functional and fun. So go ahead and share with us. But we'd like to just remind you, start early if you can. It's never too early. And find something that fits with your life and with your preferences so that you can keep at it. Set yourself up for success and for safety. I'm looking forward to seeing the chat with some of those sort of suggestions that you might have had. We want you to embrace that wobble, feel a little bit unsteady. That means you're training the right thing if you're feeling that little bit of unsteadiness as you go. And to include a variety of different types of exercises in the training. So last, of course, but not least, keep it functional, make it fun. Again, that's part of the joy of balance training is that there are a lot of options out there. So with that, I think we'll go into Q&A, but we'll put this on here. We are, Teresa and I both help with this. This is through our clinic, the exercise helpline. We're happy to answer questions about exercise as well as help with finding you a physical therapist in your area who might be able to get you started on something like this. So you can always reach out to us here. All right, I think we'll bring Teresa on. Thank you.
Sarah, thank you so much. What a great presentation with some wonderful examples just to give everyone the idea of the different components of balance. That was fascinating. Thank you so much. And the chat here has been so interesting. And again, please keep the questions coming. We'll get to as many as we can. And for the ones that we can't get to, we keep them in our office to try to direct maybe our future series to address questions that are coming from everyone. But Sarah, I wonder if I could pass along a question to you. This is coming from a person who mentions they have taken a fall. How can I get my self-confidence back after having had a fall?
Yeah, and we appreciate this question because it's so important and it's, it can be a sort of negative spiral if you don't feel confident and then don't feel like you can do the things that keep you strong and keep you steady. So we do have evidence that balance training can improve not just balance, but balance confidence along with it. So having some sort of structured and even I think, especially right after a fall, some supervised balance training can be really helpful to build back that confidence, sort of gradually work up that challenge level again and be able to address maybe some specific deficits or just some specific activities that might help prevent a fall in the future.
Yeah, absolutely. Sarah, this is a question coming in the chat from Bruce. He's referencing in the neurologist's office, there's often a test where the neurologist is standing behind and pulling backwards from the shoulders. So Bruce asked kind of a great question about he's able to stay in place, but question about what would the correct response to that test be? And what is it, would you say?
So that test, it is called the pull test and it is part of the standard neurology evaluation. Sometimes we do it in PT and sometimes we do something a little similar, but that's called like a push and release where you lean and we let go. But that is looking at that reactive balance and looking at specifically in the backwards direction because we know that can be challenging for someone with Parkinson's. If you were training reactive balance like that, what we'd be looking for is a big, fast step. So if you're doing something and you lose your balance, can you take a big, fast step to regain it? And so even in training, something like if you're practicing your single leg balance and you lose your balance, you can practice taking a big, fast step. And that's just kind of one, I guess, tie-in. We don't want to cheat the test. I don't think there is a real good way to cheat the test. But I think in our reactive training and in that test, that's kind of what we're all looking for and what we'd hope to see.
This is a slightly different topic. I'm wondering what you'd say, Sarah. The question coming from someone who's had deep brain stimulation, and a question about what sort of balance advice would you give to that person, if any different from what you just shared?
Sure, I think that's a great question. And I do think this is an area that is sort of like up and coming research and we need to know more, but we do know and have known for some time that people's balance and gait can change after DBS, and that it doesn't always help with balance and gait problems. So people might notice that other symptoms improve, but maybe balance is lagging behind or their balance just feels different. So I think what we would always recommend is advocating for a physical therapy referral after DBS. Ideally, you have a physical therapist who you work with before, and you have even a comparison of what your balance is like before and after, and you're walking to see if there's any areas that need to be newly addressed. It's also, it's recovering from surgery, and we know there's some kind of tinkering that goes on with the programming. So I think after that really sort of initial recovery time, it can be really valuable to be working with a physical therapist to identify any trouble areas and to train from there.
Yeah, absolutely. Um, another question, another question that we've had two people write in about this. For progressive supranuclear palsy, PSP, would this balance advice also apply?
Gotcha. And thank you for joining us. If you're someone who wrote in that question, we're glad you're here. I hate to say, unfortunately, there's less evidence, less strong evidence in progressive supranuclear palsy, but it doesn't mean that balance training isn't effective. It's just that it hasn't been studied as well. So we have some smaller studies and some case studies, things like that, that tend to show a good effect, but it's not necessarily as conclusive. What I do think clinically is that we see balance problems come up even earlier on in PSP than we do in Parkinson's. And so I really advocate for that early physical therapy referral, start the balance training early, start incorporating some of the functional components as early as possible. And I do think that clinically we see that it can have an effect. It's just an area that we need more research on to say if should it be different in any way than the training that we're doing with people with Parkinson's. So for now, I think an individualized and early approach is probably best. I don't know if you'd say anything different, Teresa.
Oh, I definitely agree with that. As early as possible, for sure. Um, another question coming to us is that the person is writing, I shuffle a lot. What might help with my balance?
Hmm. Yeah, so I think balance training itself might not fix the shuffling, so to speak, but often what we see when people are shuffling is that they can respond to different types of cueing in Parkinson's. And so what we might do is in balance training to practice balance, have some sort of additional cues, either something like really exaggerate your steps, right? Lift high, imagine you're stepping over a box, step over this line on the floor, step to this target that's on the table. So taking some of those bigger, more exaggerated steps during the training. Sometimes we'll also use a metronome or music, something that gives a beat or a rhythm that can sometimes help make the steps bigger and longer when there's something external to sort of time them to, or even visually to try to track to. And again, Teresa, feel free to chime in if you have other suggestions.
Same, very much so. That training, especially bringing very definite cognitive attention to these steps, I think has a lot of kind of payout. Um, a question from Susan. I know we're not advocating sort of any specific shoe, company or anything like that, but what would you comment about footwear and what might be best footwear related to balance training, if any?
Hmm, interesting. Um, Usually what we see is just like sort of athletic footwear, so sneakers, something with good support. It's so individualized what feels good on different people's feet. Some people feel like they like to be sort of closer to the floor and have sort of thinner shoes. Some people feel like they need that, and some people do need that arch support, something to sort of support the structure of their foot, so it can feel a little bit more stable as they work. I'd say work with the physical therapist and find what works for you in terms of that right balance between stability and having a little flexibility, but definitely something that fits snugly on the foot. We don't want sliding around, clogs, slippers, even some of those like slip-on shoes give too much give, and we don't want that. We want the shoe to sort of be part of the foot when you're training. Some people do balance training without shoes. Some people find that they feel the floor a little bit better. As long as you feel like that's safe, you're not catching your foot or your toes, and you're in a surface that supports that, it's not necessarily a bad thing to be doing your balance training without shoes. You just have to see for yourself how that feels and if it feels safe for you.
Absolutely. So I can tell there's been so much kind of questions coming through the chat. We can tell people are so engaged with this topic. Just want to let everyone know we've had a couple of comments from, say, Francis and Michael about different assistive devices. And I know we have a couple presentations in our past YouTube playlist. So kind of encourage you to come back to that if you have the chance. And we've had a couple people write in. Valerie says that she enjoys stepping over hurdles to help with her balance training. She also notes that her husband might hear her shuffling and call out from the other room. He'll say, pick up your feet. And so she's mentioning she has to be really conscious of that. And then, Sarah, I also want to let you know a lot of great feedback from people in the chat. Lori and John are both saying thank you for the great information. Lori's saying that some of this she might even be able to use in her own home program when physical therapy winds down. So we can tell this is a topic that's just really engaged so many people. And so, Sarah, we want to thank you so much. What a great presentation. I think we learned so much, and we could tell everyone was just so excited about this.
Thank you, Teresa. And thank you everyone for joining today. I really appreciate you being engaged and being here to talk with us. We learn a lot from you guys every time we come and we hear your questions and hear your feedback. I do also want to put in a plug. In 2 months' time, in August, Teresa will be our next presenter, and she's going to present on moving with confidence, balanced strategies in everyday life. So today we covered the exercise component, and then Teresa's going to pick up with what are some different movement strategies, or maybe briefly touch on adaptive equipment, home changes, things like that, that can kind of complement what you do with your exercise to help keep you on your feet. So we're really looking forward to that, Teresa, and we'll look forward to seeing everyone there.
Thank you to everyone so much, and we'll see you next time.
Hi, I'm Leslie Chambers, President and CEO of the American Parkinson Disease Association. Thank you so much for joining us today on our program. Every day, APDA is committed to providing helpful programs just like this one, as well as a wide variety of support groups, exercise classes, and educational programs to support the Parkinson's disease community. Whether online or in person, APDA is here for you every step of the way. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. We keep you posted on our social media channels as well, so make sure you follow us there. You can also connect to local resources and events through our nationwide network of chapters and information and referral centers. Remember, we're just a click or a phone call away. If you've enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Every gift, large or small, helps APDA support people living with PD through thoughtful programming, reliable resources, groundbreaking research, and more. Please visit apdaparkinson.org/donate today to support our critical work for those with Parkinson's. We are so grateful for your generosity. Thank you.